So this video demonstrates the dimple creation surgery under local anesthesia. Now, generally, the site of the neodimple is at the intersection of perpendicular line drawn from the lateral canthal area and horizontal line drawn from the highest point of the cupid's bow laterally. Alternatively, the area of maximum depression on sucking of the cheeks is also considered to be one of the sites for dimple creation. It basically depends on the patient. These are just the guidelines. When the proposed dimple is marked, we identify the Stenson's duct so that we accidentally don't damage the Stenson's duct during the procedure. Approximately 2 cm anterior to the proposed dimple towards the lip is our stab incision. So we infiltrate that area with lignocaine adrenaline solution, and also the site of the dimple is infiltrated. Then we wait for around 7 to 10 minutes and the procedure is begun. Stab incision is taken anteriorly, and the neodimple is formed at the proposed site, and this is the lateral view, showing a dimple on the left side of the cheek. So this is a video showing the dimple on animation. Please appreciate that there is no static component of the dimple and it is only there in the dynamic form. Thank you for watching.